Britain has become the first country in the world to authorise the coronavirus vaccine developed by AstraZeneca and Oxford University. It's the second vaccine to receive emergency authorisation from the UK authorities after the BioNTech-Pfizer jab. Trial data suggests the latest vaccine is less effective but easier to store and transport. Authorities say they plan to start rolling it out within days. Britain is struggling with a surge in virus cases that are threatening to overwhelm hospitals. I'm now joined by John Campbell. He's an independent health analyst and educator and joins us from Carlisle in the north of England. Dr. Campbell, thanks for joining us. This pandemic is hitting your country and so many others very hard at this time. How important is this new vaccine?
It really is, but this new vaccine is the best news we've had in the pandemic, and it is going to change the situation entirely. Now, in the United Kingdom, we're going to start a mass rollout of this vaccine from the 4th of January. We're going to be vaccinating 1 million people a week from that point, and that's only going to build up as the logistics and infrastructure develops. And as well as that, what we're going to do is we're going to give 1 dose of this vaccine and then wait a full 3 months before we give the second dose. So that means an awful lot of people are going to start to get a fairly good level of immunity straight away without waiting for the second dose. And of course, it also means we can vaccinate many more people. So it really is going to change the situation in the United Kingdom and in time in Europe.
But this vaccine, this new one, Oxford AstraZeneca vaccine, is the second, but we've already seen in trials that it's not as effective as the BioNTech-Pfizer one. Is it good enough?
It certainly is good enough. Anything over 50% is going to be efficacious. But we had the managing director of Pfizer making a press announcement just a few days ago saying the efficacy of this would just be as good as the Pfizer and the Moderna vaccine. Now, we don't have the scientific data on that yet, but it's looking very promising. And the key seems to be in the gap between the 2 doses. So giving a longer gap between the first and the second dose seems to increase the efficacy. So although we have efficacy figures of like 62%, 70%, up to 90%, depending on the dosing regime. What he says is we've found the right formula and we should be up there with the others. So we are expecting high levels of efficacy. So yes, it is good enough. And we believe this vaccine is safe as well.
Well, that certainly sounds promising. John Campbell, independent health analyst, thank you.
OK, thank you.